Dr. Allison Bartlett, an infectious disease expert at the University of Chicago Medicine, said the continued vulnerability to infection is why high-risk adults such as healthcare workers are routinely advised to get a second dose of the measles vaccine if they have not had one. But knowing your vaccination status can be tricky, experts said. It's complicated and often futile because it's very difficult to resurrect those old records, said Dr. William Schaffner, an infectious disease expert at Vanderbilt University Medical Center. People vaccinated in the United States since 1989 would most likely have received 2 doses of the combined measles, mumps, and rubella, MMR, shot under federal guidelines, and that is still considered the standard for protection. Anyone vaccinated between 1963 and 1989 would likely have received only 1 dose, with many people immunized in the earlier years receiving an inactivated version of the virus. Americans born before 1957 are considered immune as they would have been exposed to the virus directly in an outbreak. Merck & Co. Inc. is the sole U.S. provider of the MMR vaccine. The company said in a statement that it has taken steps to increase U.S. supply of the vaccine due to the current outbreak. Highly contagious. The measles virus is highly contagious and can cause blindness, deafness, brain damage, or death. It is currently spreading in outbreaks in many parts of the world. According to the World Health Organization, 95% of a population needs to be vaccinated to provide herd immunity, a form of indirect protection that prevents infection in people too young or sick to be vaccinated. U.S. public health officials have blamed the current outbreak in part on rising rates of vaccine skepticism that have reduced measles immunity in certain communities. For travelers to outbreak areas abroad, the CDC recommends adults consider getting another dose of MMR unless they have proof of receiving 2 prior doses, take a blood test showing immunity, or were born before 1957. In general, the CDC says 2 doses of the measles vaccine should provide 97% protection, 1 dose should offer 93% protection. However, immunity can wane over time. This has occurred even in adults with 2 documented doses of the vaccine, said Dr. Michael Phillips, chief epidemiologist at NYU Langone Health, which serves parts of New York City, a hot spot in the U.S. outbreak. He said in kids, the vaccine is really effective, but in some adults, memory T cells, which recognize and attack germs, do not fight the virus as effectively as they once did. Adults who have any doubt about their immunity should get another dose, Schaffner said. It's safe. There's no downside risk. Just roll up your sleeve.